My name is Dr. Sandra Petersen, and I am the Senior Health and Wellness Consultant for Pegasus Senior Living. And my background expands over 30 years working with seniors. I was involved in the industry of assisted living for probably during its infancy stages, and so have grown with the industry and have always had a passion for seniors and for memory care in particular. I have a particular interest in neuroscience, and the research that I've done over my years in nursing in academia has been related to memory care. One of the areas that is especially important to me is neuroplasticity, and I got to experience this personally when I had a stroke about 10 years ago, I guess it was now, and lost use of the left side of my body, so I couldn't walk. I had difficulty connecting with my language skills, so as I'm talking to you here, that would have been impossible for me to do because I had trouble with word finding. I had trouble completing a sentence. I had trouble thinking of what things were called. And so it was a very frustrating situation to be in, but it gave me not only empathy but sympathy for those who deal with that, and especially those with cognitive decline. Fortunately, I was able to work with a brain health specialist here in the Dallas area who helped me recover, and he did that by helping me build neural pathways around the damaged areas of my brain. The stroke, when I had a bleed in my brain, had damaged part of the neuroplastic network that went to my language center. So one of the reasons I was having difficulty speaking and difficulty communicating and thinking of words. And so he asked me to challenge my brain to build these new neural pathways to that language center. So he asked me to learn a foreign language, and of course, being from Texas, the logical choice was Spanish. So while I'm not fluent in Spanish at this point, I found that by conjugating the verbs, doing all those things that we do routinely to learn language when we're younger, I found doing that in Spanish brought me back to connect with the English vocabulary that was already there. So I was able to connect with those files that were already stored in my brain. And within a year or two, I was back teaching, back speaking, back seeing patients, and really don't notice much of a problem unless I'm really, really tired. The other thing he asked me to do to help with walking was to do exercise that involved cross the midline of the body type movement, and that was in order to connect synapses across the brain and to again build neural pathways around those areas of my brain that were damaged. And so he suggested ballroom dancing. Now, of course, I am not a ballroom dancer, and none of you would want to dance with me because I would step on every toe that you have. But that action of moving across the midline of the body, side to side, that comes along with dancing helped me to regain the ability to walk. At the time I started those ballroom dancing lessons, I was walking with a cane, and on really bad days I had to have a walker. But after a few months of doing the dance lessons, I was able to again walk, and don't notice a lot of problems with that now, except that when I'm tired, I do notice that I do limp a little bit, but it's nothing like post-stroke. This started me thinking, this personal experience started me thinking about how I might incorporate these ideas of neuroplasticity into memory care. And being a researcher, I was constantly thinking of ways in which I could help my patients. And I thought, if it can work post-stroke, why couldn't the same idea of neuroplasticity work in memory care? And so I began thinking about how I might be able to take those neuroplastic concepts, those of connecting through emotion, moving, and providing new information to retain and gain skills, how could I use that triangle of activity or mental activity to stimulate the brain of someone with cognitive impairment, and would that work? So I began working on programming and just trying different things with my patients to see what might work.